Pain in your right upper quadrant can be anything from gallstones to kidney infections. Hey, I'm Dr. Neil Tank, a board-certified emergency physician. And in this video, I'm going to talk about 5 causes of right upper quadrant pain. I'll discuss which symptoms matter, which diagnoses are dangerous, and which ones can potentially be managed at home. Let's get into it. Let's start with gallstones, probably the most common cause I see of right upper quadrant pain. Gallstones are hardened deposits of cholesterol or bile pigment that form in the gallbladder and cause pain, usually after eating fatty foods. Nausea is common, but there's no fever and usually labs are normal. Gallstones by themselves are often benign and can be managed as an outpatient. But if they cause a blockage, things can escalate. This brings us to our second cause, acute cholecystitis, or infection or inflammation of your gallbladder. This usually happens from a stuck stone. Unlike gallstone pain, the pain is constant and is usually associated with nausea, vomiting, and fevers. Pressing under the ribs may cause some tenderness, what we call the Murphy sign. These patients usually need IV antibiotics, fluids, and a consult with general surgery. Next on our list is cholecystitis and cholangitis. This happens when a stone blocks the common bile duct, causing bile and bacteria to back up. Here we're seeing right upper quadrant pain, fever, jaundice, and possibly low blood pressure. This combination suggests a serious infection called cholangitis. In the ER, we'll often order liver function test, imaging, and start IV antibiotics. These patients often need a procedure called ERCP to relieve the blockage. Another big one we see is pyelonephritis, or a kidney infection on the right. Believe it or not, this can actually cause referred pain to the right upper quadrant. This will often come with flank pain, along with nausea, fevers, chills, and urinary symptoms, such as frequency or burning. Mild cases can generally be treated with oral antibiotics, but serious infections may need hospitalization. Last is right lower lobe pneumonia. I know, it sounds odd, but a pneumonia in the lower right lobe can actually cause right upper quadrant pain. Trust me, I've seen it many times. That's because the right lower lobe sits just above the diaphragm, and when it's inflamed, it can cause abdominal pain. Generally, symptoms include fever, cough, fatigue, your usual pneumonia symptoms. This is often diagnosed with a chest x-ray and treated with antibiotics. So to recap, we have gallstones, which is right upper quadrant pain and colicky pain after eating; cholecystitis, right upper quadrant pain with fever and vomiting; cholangitis, right upper quadrant pain, signs of sepsis and jaundice; pyelonephritis, right upper quadrant pain with urinary symptoms; and pneumonia, right upper quadrant pain with fever and cough. If you found this video helpful, I'd love for you to give me a like and subscribe to my channel. Thank you so much for all your previous comments, and I'll see you in the next video.